All right, so hello, my name is Bailey Vanderhoof. I am filming my pediatric physical assessment for my pediatric practicum. Just before I start, I just want to note that I am in the appropriate attire. I have my stethoscope, I have my pen light, I'm in my scrubs. And for the purpose of this assignment, my patient is going to be 16 years old, a 16-year-old male who was born on September 25th, 2004. Okay, so you can come in. So I'm gonna gel my hands first. Hello, my name is Bailey. I'm gonna be your nurse today performing a head to toe assessment.
Okay.
My patient is 16 years old, so once again, I have to note that I would also be speaking to the caregiver, the parent in the room. Since my client is a 16-year-old male, if I needed to, I could also pull in like another nurse to witness the physical assessment. And then the parent will be helpful in answering I'm gonna talk directly to my patient the whole time and casually since he's 16 years old, but if needed, the parent can fill in any information that's missing. So to start, I'm just gonna, the atmosphere, so I've already introduced myself to my patient and the parent. I've already gelled my hands. I'm gonna show respect to my client the whole time. I'm gonna close the curtain or the door to make sure that there's privacy. I'm gonna provide for safety at all times. Do you feel safe right now?
I do.
Okay, so in a hospital, the bed would be locked. It would be in the lowest position. The side rails would be up. If I put a side rail down, I'd put it back up. The bed alarm would be on, socks on in the hospital, that kind of stuff. So then I will also make sure that everything is confidential. So whatever is said will stay between you and me. If anybody needs to access it, it would be your treatment team only.
Okay.
So I've gone over respect, privacy, already washed my hands, confidentiality, safety, all of that. So the first part of the assessment is just a general appearance. So I have already assessed my patient's gait. When they walked in, it was smooth, steady. There was no abnormalities with it, no leaning to one side. How have you been feeling lately?
Fine.
Good, no illnesses recently?
No.
Okay, no pain?
Been pretty healthy.
Okay. So then the next thing, I can hear my client speak. So he's articulating clearly. His speech is paced. The content is appropriate. He's speaking in English, his native language. Everything is smooth. I don't hear anything concerning. So then when I look at him, I could tell that his grooming and hygiene is adequate. He has his hair gelled. He doesn't have an odor to him. None of that. His nutrition is also adequate. He doesn't appear to be malnourished or overweight in any way. His BMI is a normal BMI for his age. He's muscular, tall. His weight appears to be appropriate for his age. So then also his mood, affect, and behavior is appropriate for the situation. So he's got a pleasant facial expression. His behavior is normal. He's sitting erect and sitting down. So nothing concerning there. So next is skin. So I'm gonna quickly just assess his skin. I'm gonna look at it. I'm gonna feel his skin. Have you had any rashes?
No.
No. Do you drink an adequate amount of water every day?
I do.
Okay, so his skin is pink, dry, and warm, which is normal. I'm also gonna just pinch his skin quick on his hand. It recoils immediately, so I know that he's not dehydrated, so his skin turgor is good. I'm also gonna test his capillary refill, so can I see your fingers? I'm just gonna press his finger, make sure it turns white. Capillary refill is less than 2 seconds, which is appropriate for his age. So that's it with his skin. I don't notice any bruising, lesions, rashes, anything abnormal. So then next, I'm gonna assess his neurological status. So already from speaking to him, I know that he is awake and alert. So what is your name?
My name's John Costa.
Okay. Where are you right now?
I am in my house.
And then approximately what time is it?
Like 3 o'clock.
And what's going on right now?
You are doing an assessment on me.
Okay.
Head to toe.
So my patient is alert. He's awake, alert, and oriented to person, place, time, and the situation. So now I'm just gonna test your muscle strength.
Okay.
So just face me a little bit. Alrighty, so you're gonna hold my hands, just squeeze as hard as you can. Good. And then resist me. Good, and then put your arms like this. Resist me again. Perfect. So, and then I'm gonna do your lower extremities. So just put your feet on my hands, just push down like a gas pedal. Good. So I'm gonna note that his muscle strength is strong. It's equal bilaterally, probably a 5, very strong. No abnormalities noted at all. So then next I'm gonna do his head, eyes, ears, nose, and throat, which is HEENT. So I'm gonna test your face. I'm gonna look at your face, make sure that everything is symmetrical. I don't see anything abnormal there. It's symmetrical. So now I'm gonna test your eyesight. So I'm gonna just have you look right over my shoulder. I'm gonna shine a pen light in your eye. Oh, that's at me. Good. Good. Okay, now you're gonna look right at this pen. You're gonna follow it. Okay, just don't move your head, just move your eyes. Okay, so I have assessed Perla and I've also assessed the 6 cardinal gazes. So for Perla, his pupils are equal, round, reactive to light, and accommodate. They constricted when I shown the light in them. And for the 6 cardinal gazes, there were no nystagmus noted, no abnormalities. He was able to follow the light. So then the next thing I'm gonna do is inspect his mouth with the pen light as well. So I'm just gonna have you open your mouth for me. Say ah. Okay. Open it wide for me. So I don't see anything, no lesions. His uvula is midline. His tongue, nothing on his tongue. Can you lift your tongue up for me? Okay, good. So everything looks normal. Can you move your tongue side to side? Okay, so that's good. So then I'm just gonna inspect his neck as well. So I'm just gonna make sure that there's no lumps, bumps, anything abnormal. Nothing hurts?
No.
Okay. You haven't had any stiff neck or anything?
No.
Okay. So his neck is symmetrical. There's no lumps. I didn't see any pulsations either. So I'm gonna inspect his carotid artery one at a time. Good. You don't want to do them both at the same time. So his carotid arteries are palpable. They're a 2+ and strong bilaterally. So then next I'm going to focus on your lungs. So I'm going to do a series of breath sounds.
Okay.
Just tell me if you get dizzy or anything. You shouldn't be out of breath or dizzy.
Okay.
Deep breath for me. Okay, so that was anteriorly. Now I'm going to do posteriorly. Just going to give him a little break for a second. All right, deep breath for me. You don't feel dizzy or anything?
No.
Okay. Okay, good. So for his lungs, I'm going to note that they are clear and equal bilaterally. As I was assessing his lung sounds, I was also assessing his respiratory rate, which was unlabored. It was 16 breaths per minute. No signs of adventitious sounds like wheezes or stridor. And it's all normal for his age. So then next, I'm going to assess his 6 cardiac landmarks. So again, just face me a little bit. I'm going to listen to your heart in 5 different sounds. So I'm going to listen with both the diaphragm and the bell of my stethoscope, so you'll see me do it twice.
Okay.
All right. So I'm going to find the first one, which is the aortic, which is going to be the 2nd intercostal space. I'm going to find his clavicle and go down. Just breathe normally for me. Next one is pulmonary. Then it's Erb's point. Then tricuspid. And then at the 5th intercostal space, mid-clavicular, is going to be the mitral valve, which is also the apical pulse. I would listen to this one for a minute with both the diaphragm and the bell. So then I'm going to do the same thing with the bell of my stethoscope. So just keep breathing normally for me. Again, I would listen to both with the diaphragm and the bell, I would listen to the apical pulse for 1 whole minute. So it was aortic, pulmonary, Erb's point, tricuspid, and mitral. So for the 16-year-old, the mitral is going to be the 5th intercostal space. Before the age of 7, the apical pulse is going to be at the 4th intercostal space. So I would note that I heard S1 and S2 in each of those locations. And then with the bell of my stethoscope, I would note that I did not hear any murmurs. And his heart rate was 70, regular and strong. So then next, I'm going to look at your abdomen and I'm going to listen. So have you had anything abnormal, any diarrhea, nausea,
No.
any abdominal pain?
No.
Okay. So I'm just going to have you lay down a little for me.
This is
Yeah. Okay. Can you lift up your shirt a little? Okay. So the first thing that I'm going to do is I'm going to inspect to make sure that everything is symmetrical. I'm going to inspect the color, the contour. I'm going to note that the hair is evenly distributed. I don't see any pulsating. Everything appears normal. His skin color is great. I'm going to test his skin turgor quick. Again, it recoils immediately, so there's no signs of dehydration there. So once I've inspected, now I'm going to auscultate because I don't want to mess with the bowel sounds if I palpate. So I'm going to start in the right lower quadrant. So after listening to his bowel sounds, I'm going to note that there were active bowel sounds in all 4 quadrants. I'm also going to note that I've looked at his umbilicus. Everything appears to be normal. If I didn't hear a bowel sound, in the quadrants, I would listen for 5 minutes in each quadrant. So now I'm just going to percuss your abdomen, so I'm going to tap a little bit.
okay.
Nothing hurt, right?
No.
Okay. And then I'm going to lightly palpate. So I'm just going to palpate, just nice and light. Nothing hurts.
No.
Okay. All right. So there's no rebound tenderness. There's no tenderness, no distension. You haven't had any problems urinating.
No.
Okay. So now I'm going to listen for vibrations over the aorta. with the bell of my stethoscope. So if listening over the aorta, there's no, I don't see any pulsations, and there's no abnormalities noted. So that's done. So you can sit up again.
Okay.
So then, before I forget, I do just want to check his radial pulse as well on both. Good. So for the radial pulse, it would be strong and equal bilaterally, 2+ for a grade. And I think that concludes the assessment. I've already done capillary refill. I've tested all of the systems. I've documented everything as I went along. So then again, anybody that could see it would be just your treatment team. If you and your mom have any questions, you'd be able to ask. And then I would provide safety before I left. So I would make sure that my client is safe, everything's confidential. If I was in the hospital, I'd make sure the bed was all the way in the lowest position, locked, that the side rails were put back up, that they have their call bell, all of their stuff in reach of them. And that's it. So that concludes my pediatric physical assessment.